Dr. Shah, thank you so much for spending some time with us today. We really appreciate it.
My pleasure. Glad to be here.
So first and foremost, maybe a little late, but welcome back to Maine.
Thank you.
How are you feeling being back here?
My family and I are so happy to be back in
Yeah.
Maine. We chose to come back to Maine because it's our home.
Yeah.
And we are so excited to be back. We're back in time for the summer. We're back in time to reconnect with our friends and other family across the state.
Yeah.
So Maine is home, and we wanted to get back here as quickly as we could.
Back in time for all the heat waves.
Back in time for the heat. Yes, indeed.
Enjoy. There'll be more later. Right. So, you're here also. Part of what brought you back to Maine is your new role at Colby College. Very exciting time for you. Tell me about that new role and what you're doing there.
There's a couple of aspects to it. Colby's president, David Green, had reached out to me to gauge my interest in coming to Colby, not just to teach, which I'm going to be doing, but also to help Colby and help President Green build out a public health curriculum. And that's what's really exciting to me and what really attracted me to wanting to spend time there. One of President Green's priorities is not just to offer public health classes, but to make the curriculum focused on ways that the graduates can be active in public health in Maine. And so a lot of what I'm thinking about is figuring out what some of Maine's most pressing healthcare and public health issues are, and then forming a curriculum around that, such that the kids that go through that eventually will be equipped on day one to work at the health department or a nonprofit and help the public on healthcare and healthcare matters here in the state.
It's so exciting that you're actually getting to be a trailblazer in building a curriculum for a major. I mean, that's huge.
It's a time-consuming project, to be sure. And so these things can take a very long time. What I want to try to do is help lay the foundation such that the folks that come after me can pick up the baton and move it forward. In the meantime, what's really exciting, particularly in this moment, when there's a lot of division and darkness around us, one of the few places where you find uniform, unbridled optimism is on a college campus. And so being able to interact with students, hear about their ideas, and pick up on some of their infectious enthusiasm, it doesn't get any better than that.
I was just going to say there's also unbridled motivation and as you said, optimism, and in a field like public health, especially with what the country went through with COVID, there's no greater need for it now, to say nothing of some of the pathogens that we're seeing return to mainstream consciousness. So no better time to put the emphasis on public health.
That's exactly right.
Yeah.
And there's, in addition to there needing to be more young people interested in going to public health, there are also a lot of older public health workers who are deciding that this is the right time to step back after the pandemic. And so we need younger people in the public health and healthcare workforce now more than ever, particularly in Maine, where again, we've seen a lot of folks retire from healthcare fields. As we think about getting ready for the next crisis that comes our way, whether it's an infectious disease issue, an environmental health issue, a climate issue, one of the core ways that we will be resilient is having a workforce that's ready to help people on day one. And that's what we're hoping this curriculum at Colby can eventually help do.
So speaking of workforces, you were, after playing a key role in the pandemic response here in Maine, you were then called to duty in Washington with the U.S. CDC. So talk a little bit about what that experience was like and what you were responsible for there.
Well, it was a tremendous opportunity, and I was honored to be able to serve at that time period. Much of my career has been in government service in the past 11 years, and to be able to move from state public health, which I had been doing, to the national, indeed to the international level, was quite an honor. It's different in a lot of ways and similar in a lot of ways. It's similar insofar as the core issues are the same. Measles outbreaks are measles outbreaks. Ebola is Ebola. However, at the CDC, your vantage point is national, if not international. And so the implications of your decisions have far more ripples than anywhere else. But I will say, for my money, state government's where it's at.
Really?
State government is the right blend of challenging problems, essential leadership, and the ability to see immediate impact. And at the CDC, at the national level, sure, you deal with thorny problems just as you do at the state level, but you don't often get to see and hear about the impact that you're having. But state government is where you get that blend
Yeah.
of real experience, real problems, and a real impact that you can see when you go and talk to people. That's why I'm in Bangor.
Yeah.
I've been meeting with healthcare providers across the city to hear about what's going on, so that ultimately Colby and myself can help engineer policies that are really helping people.
What are those healthcare providers telling you about what they're seeing and actions that need to be taken, policies that should be put in place if they're not already?
Yep. Well, on the healthcare front and on the public health front, we're hearing a lot about the concerns of Medicaid cutbacks, coupled with the challenges that we're already facing rural healthcare providers,
Yeah.
whether it's on the maternity front or just on staying afloat if you're a small nursing home in rural Maine.
Yeah.
A lot of those are exacerbated by some recent legislative changes at the federal level. So I've been hearing just today and when I was here a week and a half ago,
Yeah.
a lot of concern being voiced about that. Here in Bangor in particular, a lot of concern about infectious diseases like HIV,
Yeah.
and ways to get on top of that, ways that the community can come together. What's impressive about Bangor, and what has always been impressive about Bangor to me, since when I was at the state level, is the way that the community itself, through the Community Health Leadership Board and other vehicles, were the ways that the community itself takes ownership, takes a lead
Yeah.
in charting the pathway forward on healthcare issues. You don't see that in a lot of places,
Yeah.
but you see it in a strong way in Bangor, and the difference is noticeable.
You know, it's interesting you bring up the HIV outbreak. We were just talking about that on our news this week. And, you know, that's certainly not something that you hear about a lot. And so what do you know about the current outbreak and how it's being approached, and how does that jive with your own knowledge and expertise?
You know, I've had the opportunity to meet with healthcare, public health officials, and providers across the city. Yeah. And at the same time, there's concern about the outbreak, as there should be with any outbreak. What I've also seen and what I've heard is, again, the ways in which the healthcare, the public health, the housing, and the social services communities have all come together to try to get on top of this situation. HIV outbreaks in particular can be very slow moving. But like a lot of things in public health, it's kind of everything everywhere all at once. It goes along, and it's not something you hear about until it's the only thing you hear about. And so one of the things I've been impressed by in Bangor is the seriousness with which a lot of the healthcare and social services providers are taking this.
Well, it's a serious pathogen. You know, you alluded to, and we've talked about, you know, the U.S. CDC has undergone some very significant changes with the new administration. There have been changes at multiple agencies at the federal level. Can you talk about the impact of the changes at the U.S. CDC?
Yep. There have been remarkable changes that have been underway at the CDC. Some of them are just cutting back on finances, and that's going to be a problem as we think about being ready for the next big infectious disease outbreak. But what I hear more about are structural changes to the way that the CDC and indeed other federal agencies go about their business. One of the ways the Trump administration approaches a lot of these issues is essentially through saying states lead first. Rather than large-scale federal policy, states get to call the shots. Now, I think that breaks down in certain areas, which Maine has seen firsthand. But what that also means is that the input, the guidance, the on-the-ground experience offered by state agencies might get pulled back, whether it's in emergency management, in public health, or in other areas. So states are going to have to go it alone more than they did before, both from a technical, scientific perspective, as well as from a financial perspective. As we think about a world with more disasters, more infectious disease outbreaks, things of that nature, that's going to put a double challenge on state health departments.
Kind of reinforcing your point that, as you said, state government is where it's at. The leadership on the ground is, you know, is immediate and immediately impactful, and the need for that next generation to step up into public health, again, that much more important. State
governments are more important now than I think they've ever been, or at least in recent modern history. And that's partly because they will be expected to foot more of the financial bill, but they will also be expected to foot more of the technical expertise as well. So once again, state government's where it's going to be at.
So we've touched on this, but anything else that state CDC agencies should be looking out and bracing for, thanks to the changes at the national level that you haven't already touched on?
One of the things that some of my colleagues, former colleagues from the U.S. CDC and I have been working on is trying to figure out how states can continue doing what they've always done, which is to take the lead on these matters. There are various national groups that are trying to organize states and state experts to think about vaccine policy that is coherent and uniform in an era where the federal government, the CDC, may be hesitant to come out with strong pronouncements on who should be vaccinated. Are there ways that states can fill that void, for example, on vaccine recommendations? So this is a sign of things to come. The other area that some colleagues and I have been thinking about is in crisis response. Because there too, the administration has signaled that some of the classical actors in crisis response, FEMA, the CDC, et cetera, they may not be there as much. So how can states start banding together to fill that void?
Interesting. I want to shift to a topic that you were very deeply ensconced in, the COVID-19 pandemic. We're several years out now. I think many of us view COVID-19 as, by and large, in the rearview mirror, at the ground level, and that, we'll never totally be rid of it, but that, we've gained the upper hand. I think many people feel that way. Is that a safe perception?
I think it is. You are absolutely correct that the world will never be rid of COVID. It will always be with us. And like all infectious diseases, it will flare up and die down in periodic waves. That said, it is not the acute health risk that it was before. With vaccination, treatment, et cetera, COVID need not be the almost death sentence that it was for so many people. Over 1 million people in the United States. Nowhere near those numbers. Is it still a risk? Absolutely. But it joins the other risks that we are all comfortable navigating on a day-to-day basis. And so it's not a unique risk as it was, say, 5 years ago.
The contentiousness of COVID was unparalleled, though. So are there lessons to be learned about transparency in bringing people along with that journey?
Yes, absolutely. One of the things that I think public health could have and should have done a better job, and I include myself in this, to be very clear, is to signal ahead of time the ways in which science can and should change, and how that's a sign of strength, not a sign of weakness. The thought experiment I offer to folks is, imagine if one of your loved ones had cancer and you walked into the oncologist office and that oncologist said, hey, you know what really burns me up? It's when all these doctors change their minds all the time. And so I want you to know that as your doctor, I'm going to practice cancer medicine the exact same way that I learned it when I graduated from medical school 40 years ago. Because changing my mind is a sign of weakness. So I do the same things that I did 40 years ago. You would pick up your family member and get out of there. Right? Because you want the latest and greatest. And we all understand that when it comes to ourselves. But when it came to public health, we didn't channel that. We didn't signal that I'm going to know more tomorrow than I know today. And that's a good thing, not a bad thing. So when the next crisis comes along, whether it's public health, whether it's climate related, whether it's a natural emergency, a man-made emergency, one of the things that I think leaders can and should do better is to say, I'm going to know more tomorrow. And I want you to know that now, because what I know today is going to change, and that's for everyone's benefit.
I think there was such an element of public fear, and rightfully so. I mean, we were living in isolation. We were on lockdown. There were thousands of people dying. And so it was challenge. We were in a very challenging space mentally, physically, emotionally. And then you add evolving science, which, in other narratives wasn't a problem. We know more about the flu than we knew at the beginning. But because there were all of those other elements at play in COVID, that lack of transparency really was gasoline on the fire.
It really was. I mean, everyone, we were all nervous to begin with. And any change in a setting of that where there's high stress, low trust, any change is going to be met with tumult. And I think we saw that firsthand. That is a lesson for future communications. The fact of the matter is Maine is going to face another crisis. I don't know what it's going to be. I don't know what that crisis will look like, but another crisis is coming. And so the state's ability to communicate and to be effective in those moments is going to be what gets us through. In my book, that is what matters when it comes to resilience. One reason we were so dogged about making sure we were doing communications, in some cases press conferences 5 days a week, was that in a crisis, the only thing you have is your credibility. And when you're not communicating, misinformation will fill that void. And one of the things I'm proud of in Maine is the way in which we were able to forestall a lot of that misinformation, because we were filling that void with accurate scientific information.
I want to ask about, and this will be our last question, but in addition to that lesson learned about the importance of transparency and the execution of transparency, what other lessons do you take from, maybe not just your experience with COVID, but also, obviously that's a big part of it, do you take from that you then implement into this curriculum that you're building?
Oh, yeah. So one of the ways in which we're hoping that this curriculum is responsive to Maine's needs is that we're going to be taking the pulse of what issues are relevant right now and then putting those into practice. Just going back to that point, one of the courses that I'll be teaching in January that I'm particularly excited about, based on this conversation you can tell, is a short course on crisis communication. Because no matter what your job is, no matter who your audience is, at some point all of us have to come up and communicate in a crisis, whether it's with your boss, your board, your friends, the public. And so I'm really excited to expose that form of communication to Colby students. Some of them will go into public health careers, some of them will go into something else, but they're all going to need, in a crisis, to be able to stand up and talk about what they know, what they don't know, and what they're doing to find out. And so I'm really excited to be able to coach them through that process.
Well, because in those situations, communication is life or death.
It's the only thing you got.
Because how you communicate or don't communicate dictates whether people find you credible and whether they follow what you're telling them to do.
Especially in a crisis. I mean, a key to this is to gauge and understand how crises are different from day to day. In a crisis, tensions are high, trust is low, our ability to process nuance goes out the door. And so the imperative to be clear, to be concise, and compassionate is more important than anything else. In addition to that, the importance of not overstating what you know and admitting when you don't know something is never more important than in a crisis.
All right. Well, thank you so much for sharing with us today. We really appreciate it. We look forward to the evolution of your curriculum and your program. We hope you'll keep us informed.
I can't wait.
All right. Thank you so much.
Thank you. Thank you.